Hello and welcome to Care Plus Live. We're here every Monday, Wednesday, and Friday around 11:30 a.m. sharing tips and techniques for mental health during this time. This week's theme has been Overwhelm, and today's message is brought to you by Ellery Tarife, who is a nurse practitioner at Care Plus New Jersey. And happy Nurses Day, Ellery. We're so grateful for everything you and all of our prescribers do for our community. So Ellery has worked in the field of family medicine for 19 years and 7 years of experience in serving those with addiction. He joined the Care Plus team in 2018, which was right after we became a CCBHC and started our outpatient withdrawal management program. So Ellery is our expert on medication-assisted treatment, one of our experts on addiction and substance use. So we're very grateful to have him here today, and I'll hand it over to you, Ellery, to share your message.
All right. Hi, Caitlin. Thanks for having me on. And again, thanks for everyone watching. So again, my name is Ellery Tarife. I am one of the nurse practitioners at Care Plus, and my main role is really to provide support for the addictive services line and to provide medication management to those with a substance abuse history. In the current times we live in, the uncertainty of what the future holds, as well as the stress of our current environment, can be overwhelming. Stores are closed, supermarkets limit the number of people, we are asked to stay home, and essentially to avoid people. This is the complete opposite of what we always recommend our own patients and clients. In mental health, we encourage people to go out, to be with others, to socialize. And once we remove that, it is hard to say if that may lead to an increased rate of depression and or decompensation of one's own mental health. So this brings us to the idea of coping. When we choose coping skills, they can be positive or they can be negative. As a result of the COVID pandemic, I have started to hear more about people increasing their alcohol consumption. We have people working from home, managing their children's school life. We have people that are losing their jobs. And then, of course, there's that decreased social interaction, as well as the constant reminder on television of what the situation of this healthcare crisis looks like. Now, whether people are drinking more out of boredom, or perhaps they're drinking more as a coping mechanism, we have to be mindful that this may lead to a problem and possible addiction down the road. This also relates to benzodiazepines such as Xanax, Ativan, Valium, and Klonopin, just to name a few. Patients who are already on it may be abusing it or may be increasing the usage. And there are always potential hazards that can arise in the future, even though they work. Those who are struggling with heroin and opiate, that's always another concern that's been prior to the COVID pandemic. There is always a concern, again, of poor coping skills and increased use and possible relapse. The good news is that there are medications to help with all of these substances, along with the therapeutic portion of it. And knowing that Care Plus has those options readily available should help the community be a little bit, provide more information for the community. So again, during this pandemic where people are facing a lot of unknowns, a questionable future, financial strain, and of course, mental illness and substance abuse. If you know anyone, or if you yourself are struggling with mental health or substance issues, please know that Care Plus is a phone call away.
Great. Thank you so much, Ellery, for taking the time and for sharing with us today your expertise. For those who are listening, if you or a loved one are seeking support and could benefit from Care Plus addiction recovery services, there's a phone number in this post that you can call to get connected to the different levels of treatment. We also have the phone line for our admissions team. That team's also available Monday through Friday from 9 a.m. to 5 p.m. and can connect you and your family to telehealth support from your home within 24 hours. That phone number's in this post. And finally, regarding MAT, that's the gold standard of addiction treatment. There is a link in this post from My Strength that gives tips on how to prepare for your first MAT visit. And just to emphasize, that's an important service that Ellery allows for us to be able to offer through Care Plus. So we're here for you, we're here for your family, we're here for our community. Thank you again, Ellery, for joining us today, and thank you all. Have a really great rest of your day.
Bye-bye.